and welcome to In Touch with Durham County. I'm Deborah Craig Ray, General Manager of Strategic Planning and Innovation. Joining me is our co-host, Wendy Jacobs, Chair of the Board of County Commissioners.
Thank you, Deborah. We use this show to share vital information about the wonderful programs and services provided by Durham County Government.
I'm excited to note that we will hear about our community health assessment from Marissa Mortiboy and Jannah Bierens of the Durham County Public Health Department. Chair Jacobs, let's begin our discussion.
Well, thank you, Marissa and Jannah, for being with us here today. And can you please share with our viewers just an overview of what is the community health assessment?
Sure, I could do that. Thank you for having us on today to share information about our community health assessment. And so it's a process that we do every 3 years in partnership with Duke Health, the Durham County Department of Public Health, and the Partnership for a Healthy Durham. And we work together to talk with the community about what issues are most important to them that impact their lives. And so throughout this process, that takes about 1.5 years, so we do it every 3 years because Duke Health is a nonprofit hospital, so the Affordable Care Act mandates that they do a health assessment every 3 years. The state requires that local health departments do it every 4, but we moved to Duke's cycle since they also, since we work together on the health assessment. And so we talk to community members, we do door-to-door surveys, and we do listening sessions so people can give us more detail about what impacts their lives related to the health priorities. And for the first time this past cycle, for the 2017 Community Health Assessment, we did a community prioritization survey. So we did surveys, we asked the community, tell us what the top 5 priorities are. And so the community did tell us, and they gave us suggestions as well as how they wanted to see these priority areas addressed.
So Marissa, could you tell us what are those top 5 priorities that came out of the Community Health Assessment?
Yeah, so the top 5 priorities from the 2017 Community Health Assessment are, for the first time, affordable housing. That hasn't appeared before and is the #1 priority, and followed by affordable access to health care and health insurance, then poverty, 4th was mental health, and 5th is obesity, diabetes, and food access.
So I find that very interesting that at least 3 of those are related to social determinants of health. Maybe could you just talk a little bit about what that means to have affordable housing, poverty, are things listed there?
Sure, and so we talk about social determinants of health. Those are things that impact the quality of life. So those are things like jobs, education, housing, which you mentioned, and transportation. And so these are factors, depending on where people live in Durham, in the city and the county, can really impact their lives. And so we realize that when we talk about health, it's not just diseases, chronic illness, and that impact health. It's the factors, the social determinants that I just named. And we know that they're linked as well. So poverty, housing, those are top priorities. And so, if someone doesn't have adequate housing or quality housing, what does that mean for them? That means that they have mold, or they have something that could cause asthma, or if someone lives in an area that doesn't have access to grocery stores with fresh, healthy foods or sidewalks to be active or in a safe community, how does that impact their ability to get exercise? And so looking at these factors, and that's one thing about the health assessment is that we look at a variety of factors that impact health. And so we address those through the Partnership for a Healthy Durham and our community partners.
And that conversation just reminded me of this visual that we've seen. I think it was in a form of a video, but it showed the difference between mortality rates, basically, based on your zip code. Where you live in a community does indeed impact how long your lifespan can be. That's important to note.
Yes, and there are differences in Durham County as well. We've actually done mapping. Some of our health educators at the health department have done that and shown an 11-year difference between central Durham and southwest corner of Durham as well, and those because of the factors, the social determinants of health, what people have access to and what's in their communities.
Absolutely. Now, what does the county actually do to address those top priorities once we've identified them?
Well, I'm actually going to let Jannah handle that and talk more about the work of the partnership as response to the community health assessment.
Okay.
So the Partnership for Healthy Durham, the goal and vision and mission of the Partnership for Healthy Durham is really just to make sure that everyone has improved quality of life in Durham, all residents. And we base our subcommittees that the partnership is formed around just based off of what Marissa just talked about with the community health assessment. So we take what the community says and we listen to what their priorities are. And we had to actually shift this time because health and housing had never been identified in the past. So this was the first time in some years where we actually had to change the structure and add the subcommittee of health and housing. And we added health with housing because we really wanted to get people who are already working on housing in Durham, because there's some few groups that are doing some work, get them together, convene them, and then also help them to understand that we need to prioritize health with housing and how that intersects and how where you live as far as your community, how much you're spending on your housing, and if it's adequate or not, how that impacts your health for the short term and long term. So that was one new subcommittee. Mm-hmm. We kept the other three. We kept mental health, access to care, and ODAFA, which is the acronym for Obesity, Diabetes, and Food Access, was formerly known as the Obesity and Chronic Illness Committee. Right. So we just had a name change, and everything was done by voting. And then we ended up changing, so we have all these subcommittees that we work on, and each of those may have work groups. So there's 2 co-chairs for each subcommittee, and they may have work groups because there's certain projects. For instance, ODAFA, when it was OCI or Obesity, Chronic Illness, they had a physical activity group, a group that was focused on nutrition, and then an education group. So even within the committees, we have people working on specific things that are all based off of the action plan that we work on. And right now, I think we have 3 action plans that are complete and located on the website. So everything we do, all of our projects, action plans, work groups, meetings, agendas, all on the website so people can be involved and come in as they wish to engage. So community members, nonprofits, government entities, it's a cross collaboration. So it's all about the intersection of the things that we think about right away with health, but then the things that we may not think about that actually can impact those social determinants that you were just talking about. So what are some of the root causes to why people make certain decisions? Or even if they have education and information, do they have accessibility? And is there community nurturing for healthy changes and sustainability with being healthy and changing that whole culture? So that's what the partnership works on. It's a lot. We've got close to like 500 members, and it's fun. It's a lot of great work and a lot of good stuff going on with the partnership right now. So.
And I can imagine that a lot of the work that you're doing would be more in the line of research-based and best practices. Is that right?
Yes, ma'am. So we do a lot of science and evidence-based programming, but what we've been doing this time, which is a little bit of a shift, in the last few years, we've been talking more about equity, health equity as a whole, but also racial equity, which is something that Durham County has helped to sponsor with other entities to have people learn more about equity and the different layers that go along with it. And due to that, and what the community has said, we had to add a structure change, and we now, and this is new too, so it's really exciting right now, we have racial equity principles that guide all of our work. So above the steering committee, trickling down into each of the action plans so that we're looking at policies and systems and environmental changes and not just focusing on individual behavior, but what can foster people in achieving those individual behavior changes.
Very good.
So Jannah, it's really exciting to hear about the work of the partnership. And you mentioned that there are like 500 people involved. Could you tell us more about who are members of the partnership? Who are the different stakeholders?
Okay, so of course we have quite a few people from the Durham County Department of Public Health, just from various divisions though. So it's not just centered on nutrition or health education, but we have different entities from within the Public Health Department. We also have a lot of different Duke clinics and different partners, because Duke has different sectors or segments within it. So when we say Duke, it's not just one entity. There's a lot of different moving parts with that. So we have a lot of different Duke folks coming in. Lincoln, different nonprofits like the YMCA and social justice groups, committees and groups that are already doing a lot of this work. We just want to be more of a convener and try to be neutral so they can come together and with community members. So Durham residents are welcome to join in any of our meetings, our monthly meetings we have for each of the committees, subcommittees, and they can engage as they wish. They can opt in for the newsletter, or they can come to one meeting, they can come to all of them. They can help with specific projects. So it's up to them how they do it, but it's a cross collaboration across systems, sectors, and really what's needed in order to address everything that impacts our health.
So I think, hearing you both speak, it just really brings home how fundamental health is just to basically everything else. And how can citizens find out about more information about the partnership and how to join a committee, or when the meetings are? Where would they go to find that information?
So the website is www.healthydurham.org, and that is the website, like I said, that has everything from agendas to minutes to the projects we're working on. Any recent data, the community health assessment is going to be on there. So Marissa does an awesome job of keeping it. She really does keep it updated. I love looking at the website because I can always, even though I can't go to every single meeting, I get to see what everyone's working on. And if I know that a committee is about to work on something that's interesting to me, I know I can join in on that meeting whenever, and I don't have to have been coming, that I can opt in and out. And then I think it's important for that flexibility for people who work or volunteer and want to be able to engage in different ways. But the website's the first place to go. That's always kept up to date.
Can you give us an example of some of the accomplishments over the past few decades, and also just examples of what are some concrete, what are some things that are being worked on right now? Okay. Some projects.
So Project Access was something that was big that came out of the Access to Care Committee, which was helping link people who don't have insurance or are underinsured to making sure they get health care or insurance. That was a big one. Also, the Healthy Mile Trails. I don't know if you guys have ever seen any. We have about 6 in Durham. And so my dream is to make those go viral. But I was part of the very first one. So that was just exciting to see that we have 6 now. People actually can request the Healthy Mile Trail, which are 1-mile loops located in different communities or neighborhoods where people, because they identified in a former community health assessment that where they want to exercises in their community or in their neighborhood. So we wanted to be able to help them with that, and that's how we came up with the Healthy Mile Trails. Durham Knows is an HIV campaign that's really popular in Durham, and they spawned from the HIV STI committee, which we actually no longer have, but they're still doing a lot of work within the Access to Care committee and underneath the health department because they're doing such great work. We didn't want that to end, but we did understand that our commitment to the community was to make sure we changed that structure to reflect what they wanted. So they're still doing a lot of great work, and they do a lot of cultural type of events, from HIV and hip hop, which was an amazing event, to things like coming out to Juneteenth and doing testing and education information. And wherever I see them, they just always look happy and bright colored. And love it. Yeah, and so it really makes you want to talk about these things that are really difficult to talk about. Yeah.
And I do want to mention as well, so Jannah mentioned several of the things that we've done, and so in 2014, Durham County won the Robert Wood Johnson Foundation Culture of Health Prize, and that's as a result of all the collaborative work that we do in Durham County to improve the health of community and working with the community.
Yeah, I remember that we were so excited to get that news, and we continue to promote that idea because, again, this is really fundamental to what we do as a county. Mm-hmm. Yeah. Yes. So what are some of the key findings that you'd like the community to remember about this latest report?
So before I mention any key findings, I just want to mention, too, that this is a huge effort. And so we had 95 contributors to the document. And so these are writers who are partners, community members, stakeholders. We have 14 chapters. Mm-hmm. We actually added 1 chapter in the 2014 assessment on older adults and adults with disabilities. But for the most recent health assessment, the community came to us and said, there's not a lot of information here on LGBTQ issues. Mm-hmm. And so we feel like this needs to be a dedicated chapter to this. And my response was, okay, if you could pull enough people together to write, then sure, we'll add it. And so we have 6 sections within that chapter. And one of the things that we found is that there's just not a lot of data out there. And so we try to include data from local data, as much as possible, and also state and national data where it applies. And we found that there's not a lot of data for the LGBTQ population, and so that's our finding. That's something that we're working to address. And so what can we do to collect data so we have that information? So for the next health assessment, we don't have the same issue.
We did add some more to the racialized and ethnic disparities section, which was very small in the last community health assessment, and this was my first year working on that as an author, but in the past I had been on obesity, so it was interesting that the group we worked with, we had a lot more to add to that as we looked at what some of those disparities might be in Durham, specific to Durham. So I think that was something that was interesting to see grow a little bit more.
Yeah, one of the things that we hear a lot across the nation is the opioid crisis. So did we see that reflected in our community, or what level was that?
And so there's a section on substance use in the document, and so we do have information about the opioid crisis. And from what I understand, that we do have an issue here in Durham. It is not at the level as it is in other places across the country, but we still do have an issue. And we've actually received, I believe, a couple of grants within the last several months to address the opioid issue in Durham.
Good deal, good
Right.
deal.
And I've used the community health assessment now several times. It's how many pages? I think
It's 454 pages, but that's down from 720
Right.
pages in 2014.
But there's so much useful information there for residents, and I really enjoyed seeing that section about LGBTQ health. The other section that really jumped out at me was on our refugee and immigrant population. I thought was really great to see. So it just, again, and it really digs down into things like mental health issues, bullying, substance and medication misuse, and how it pertains to those groups. So I feel like we're really making some progress in how we really look at these issues and how they impact our community. So,
Indeed,
Yeah.
indeed.
Yeah.
So what do we know about our teens? And I'm particularly interested in like e-cigarettes and how that's impacting them. Was there any data there about that?
And so we do so the health assessment every 3 years. Then every 2 years we do the youth risk behavior survey, and this is in partnership with Durham County Schools. So we did a survey in 2015, and then again in 2017. So the report hasn't come out yet. It should come out sometime in December, but just as a sneak preview, a couple of the highlights that we found is that e-cig use for Durham County high school students is actually below the state average. And we also found too that the percentage of high school students getting 8 hours or more of sleep a night has actually increased since the 2015 survey. And we're looking at that with the policy change for Durham Public Schools and the start time for high schools to see if that was, a contributing factor to teens getting more sleep. And so there'll be
great news.
It really is.
so there'll be lots more
Yeah.
data across physical activity, nutrition, substance use, and lots of other issues as well. And so that'll be available on the partnership website. And so as soon as it's available, we'll push it out and let the community know where to go to look at the data.
Yeah, well, that's really great. Again, health is just kind of top of mind. And, you've kind of have to start with that. And then everything else kind of leads from good health.
Yeah, and I would say, that's one reason when we look at the Durham Orange Light Rail project, why, it's so important for our community, because when you think about people being able to have more time with their families, spending less time on buses, and being able to walk, reducing our air pollution, having better access to higher paying jobs, less stress, economic mobility. We know that transportation and housing and our whole affordable housing strategy is related to the light rail. So what we're really talking about is how we improve the health of people in our community at all zip codes.
Yes.
Every zip
That's
code.
right. Zip code.
Yeah.
Well, we'd like to thank you guys so much for being with us today, and thank you for all that you're doing to ensure and help improve health in our community. Is there a final thought you'd like to add before we wrap up?
And so I think one thing I would like to say is that we want to work with the community. We do have community members, but we would love it if people viewing this episode either go to our website, or they could even call me, Marissa Mortiboy, at 919-560-7833 if they want to get involved with the partnership and improve the health of all Durham residents.
Okay. Jannah?
Lots of fun. Come join us.
Well, we've had a wonderful show today, and we've shared some great information about our health.
Absolutely. Thank you so much, Marissa and Jannah, for everything that you're doing, and for your invitation to the community. And we appreciate you being a part of great things in Durham. Thank you.
Thank you.
And we'd like to thank you all for joining us. Please take care, and we will see you back next time on In Touch with Durham County. Cheers.